United Ortho is proud to introduce its new functional knee brace, the FKB.
Hi, my name is Mike. Today I want to talk about United Ortho's new functional knee brace called the FKB. This video will show you how easy it is to apply in just a few simple steps. The FKB is available in three options. There's an anterior frame, which we'll be discussing today. There is a step-through frame, and then there's also a PCL version available. Before we talk about the application process, let's make sure that the brace is properly oriented. The top of the brace can be identified by the thigh cuff, which will be larger than the calf cuff. Also, these quick-release buckles will always be on the inside of the knee. So this particular brace is designed for a right knee. The first step of the application process is to release the straps. To do this, simply press the four buttons located on the medial side of the frame. You'll notice that the tibia strap will still remain in place. While seated at the edge of a chair, extend your knee to 30 degrees, also known as a gas pedal position, and apply the brace. If you've ever been fit by a medical professional in the past, you'll want to leave the tibia strap in place. If, however, this is your first time applying the brace, you'll want to adjust the tibia strap. In order to do so, we are going to use strap number 1 and the tibia strap and make sure that the hinges are aligned over the condyles of the knee. So we're going to start with strap number 1 and wrap it around the back of the leg and attach the quick release buckle. Next, we're going to add tension to strap number 1, but we want to make sure to avoid rotation of the brace. So we're going to anchor the brace with our other hand and pull to add tension, then refasten. Next, we're going to add tension to the tibia strap, and you'll notice as I do so, these hinges will slide forward to sit right over the condyles of the knee. So pull to add tension and make sure those hinges are aligned over the condyles. The next step in the application process is to attach the straps. If you look closely, you notice that each strap is numbered numerically. Starting with strap number 1, wrap the strap around the back of the leg and attach the quick release buckle. You will hear an audible click when it engages. Next, you want to add tension to the strap. However, you want to make sure to avoid rotating the brace when you're adding tension. In order to avoid rotation, anchor the brace with your other hand, pull on the strap to add tension, and then refasten. Do the same thing with strap number 2. Wrap it around the back of the leg, attach the quick release buckle. Now you will notice when I add tension to strap number 2, the calf cuff will rise off of the tibia about ½ of an inch. Now this is an important aspect of the application process, and it should happen every time. So I'm going to anchor the brace with my other hand, pull to add tension, and then refasten. Do the same with strap number 3. Wrap it around the back of the leg, attach the quick release buckle, anchor the brace with your other hand, and pull to add tension. And finally, strap number 4. Wrap it around the back of the leg, attach the quick release buckle. Now you'll notice as I pull on strap number 4 to add tension, the calf cuff will then become flush with the tibia. And that's how you know you have a properly fitted brace. So I'm going to anchor the brace, pull to add tension, and refasten. After you've attached the straps, the next thing you'll want to do is get some natural movement in the knee. Perhaps walking around a little bit will help allow the brace to settle. If you notice a particular strap is too loose or too tight, simply unfasten and readjust as needed. Finally, there are 3 things you want to double check. Number 1, make sure that the hinges are aligned with the center of the patella. Number 2, make sure that there are no gaps between the brace frame and your leg. And number 3, make sure that the brace frame is aligned with the anatomy of your leg and that the hinge is directly over your condyle. This is going to allow you to go through a natural range of motion without restriction. Here we have an example of the FKB on a knee. If we look at the straps, we can see that strap number 4 is too short and we're not able to get good tension. In order to fix this, we're going to make strap number 4 longer. Ideally, you want each of the 4 straps to line up along the back of the leg. In order to do this, you'll hit the quick release buckle, remove the strap pad from the strap, unfasten the Velcro, and then pull on the strap to give it more length. Align the strap pad back in position, attach the quick release buckle, and then pull to add tension. Now you can see we have all 4 straps align the back of the leg. In some cases, the strap pad will be too long and prevent the strap from a proper fit. The simple solution is to trim the pad to the proper length. To do this, remove the pad from the strap, measure the distance between the frame pads, and then trim the pad to the proper length. Reposition the pad and attach the strap. When fitted properly, you should be able to pull the strap snug against the leg. If there's a gap at the knee joint as shown here, one option is to change the condyle pads. Each FKB comes with 3 different condyle pads in varying degrees of thickness to accommodate different leg shapes. The process for changing condyle pads is very simple. With the brace removed from the leg, simply remove the existing condyle pad from the inside of the hinge. Take a thicker condyle pad that comes with the brace and simply replace it. Now reapply the brace to the leg as shown. To change a flexion or extension stop, the first step is to remove the condyle pad located on the inside of the hinge. Here is where you will access the hinge to control the range of motion. Here you can see we have an identical hinge without the brace frame. You'll note that each brace comes pre-installed with a 0-degree extension stop to prevent hyperextension. In order to change the extension stop, the first step is to remove the screw with the Allen wrench that is provided. Next, flip the hinge upside down and remove the stop. Choose the proper extension stop as directed by your medical professional. Insert the 30-degree extension stop into the hinge. Remove the proper flexion stop as directed by your medical professional. Insert the stop into the back of the hinge and then insert the screw through the top. So as you can see, it takes just a few simple steps to apply the FKB. It'll also give you the confidence that your knee will be protected when you need it most. If you have any questions or comments, please contact our customer care department and we'd be happy to help. Thank you for watching this video and have a great day.